Good evening, everyone. Welcome, welcome, welcome. Thank you so much for joining us this evening. I am so excited for you to meet the two speakers that we have here this evening. I am Yvonne Harris. I will be your host this evening, and I am also the founder and CEO of Open Arms. For those of you who don't know much about Open Arms provides holistic healing through mental health counseling, therapeutic activities, and education for antepartum and postpartum care patients. We also offer grief counseling for families who suffer stillbirth, miscarriages, and other forms of infant mortality. Um, right now, I'm going to decrease and allow my speakers to increase. And the first person you will be meeting is Miss Baron.
Hello, good evening, everyone. My name is Darlise Barron, and I am a licensed clinical social worker in Miami, Florida. I have private practice, and I've been in practice for over 20 years. I am a certified hypnotherapist, sex therapist, couples counselor, and a certified substance abuse counselor. So today I am going to present the mental health aspect of antepartum, or what we call during your pregnancy experience, right? So as we know, when we're pregnant, or most women, when they're pregnant, they have different emotions that goes on for them. They are happy, they're sad, they're surprised, they're, angry. So there's a lot of emotions that are associated with being pregnant, right? And then the hormones goes bananas and everybody's like, oh my God, you're so hormonal, right? And it's not just the hormones. So during getting ready for this presentation, a lot of things stood out for me, and I didn't realize how much mental health affected pregnant women. So what I found was that 1 out of 8 pregnant women suffer from depression. And so if we're suffering from depression during our pregnancy, what does it look like after our pregnancy, right? And that'll be on our part 2. That's coming later on in October. But for today, what we're going to talk about is during the pregnancy, during the 6 months of pregnancy, right? What is happening? We're having all these hormonal imbalance. We're having these mood swings. We're crying. We're happy one minute. We feel overwhelmed the next minute, right? And as we're processing this new little being that's inside of us, our emotions are processing itself, trying to just relax and just trying to have our mind kind of like correlate with our body and keeping score, right, per se. So one of the things that is happening is that our mental health is being affected. And the other part that I found that was really incredible was that now what they're saying is that the mental health is so important. It's even more important than gestational diabetes, postpartum hemorrhaging, premature birth, preeclampsia. So when we're pregnant, those are the things that we'll hear about the medical part, not so much about the mental health, right? And what we're finding is that mental health is now trumping everything else in our bodies, in our world, to make us more aware of our bodies, more aware of the child, more aware of the changes that are taking place, right? So now what we're saying is that even if you have, certain signs and symptoms that you're experiencing, it's okay. It's okay. It doesn't mean that you're less than. It doesn't mean that you're a horrible person. It doesn't mean that others will judge you if you have any concerns or these feelings that you're going through. And what it means is that now you have to be more aware of your body, what your mind is saying, what your body is saying, for you to kind of get that balance that you need, right? So if you're experiencing like if the pregnancy was unplanned, you're thinking about financial stress, your partner is involved or not really involved, not helpful or abusive, if you don't have adequate support, if you're concerned about childcare, healthcare, and with healthcare now, thank goodness that at least for now, if you are pregnant, you can reach out to the government and they can give you Medicaid at least during your pregnancy if you don't have it, right? That can also decrease some of the stress. Or any traumatic events that have made that's been passed down, or some kind of cultural thing that you'll hear about, that hey, if you don't do this culturally, this will happen. It's to breathe. And I tell everyone, you're stressed out, just stop, breathe it through, breathe it out, and keep going. It's not the end of the world. It's not that bad. Just breathe. And there's always someone here. Open Arms, right? This is why Open Arms just got started, and I joined in because we know there's a lot going on for us as mental health providers, as mothers, as clinicians, as just being human beings. And if you're pregnant now during this time with COVID, that's just a whole other level of anxiety that we're talking about.
So, Darlise, question for you. What
Yes.
would you recommend to our moms um, on how to improve the situation, if you will? Any type of self-care recommendations? What could they do? Because a lot of people thinking that there's nothing they can do. They're in this situation. They have no one to speak to or speak with. They don't have much support. What would you recommend for our moms?
My main thing that I talk a lot about these days, it's the body keeps the score. There's a great book out about the body keeping the score. And if the body's keeping the score and you're stressed, what do you think is going to happen to this little baby, right? The baby's also going to keep the score. It's trying to be mindful about what's happening. If you're tired, take a nap. If you're hungry, you're craving, try to find something to snack on, healthy snacks, not so much sugary, not, the coffee or the tea. And some books say that even with the tea, you can have 1 cup a day. The coffee, the caffeine, 1 cup a day. It's not going to affect the baby. Alcohol is a no-no, people. No, no. No alcohol. But the tea, the coffee, being calm, being mindful, involving your partner, involving your family, involving your best friend, to try to just be there for you and having a shoulder for you to just lean on, that you have this person that you can call, right? That's the beginning of our birth plan. Who's my support system? Who can I call if I'm feeling some kind of way? Who can I call if I need, a break? Or just to talk this through to help me, right? Be open about your feelings. Being open means to friends, to family, to your doctors, to your doulas, to your midwife, because sometimes mental health affect us so much we're unable to get out of bed. We're unable to talk to anyone, and we miss our appointments. Those appointments are important, right? If that's the route that you want to go, those appointments are very important to make sure that you're healthy, the baby's healthy, and everyone and everything is growing properly, right? Have someone, COVID, a curse and a blessing. Now we can have our list to go to the supermarket. We can pull up and they can put the food in the car for us. We can have our groceries delivered. So that's one last task that you have to do, to worry about. If you have stairs to go up or down the stairs, or you're living in an environment where it's going to cause stress to your body, we have these services now that are more prominent to us or more available than we thought about in the past, right? And overall, finding your mental health services that's near you. It could be Open Arms, it could be from your OBGYN, or it could be your midwife or your doula that you're sharing your experience with, and that they can also help you.
Oh, that's Awesome. That's awesome. Now, another question that I have, what kind of therapeutic activities would you recommend to mom? Because a lot of them don't think about it. And maybe there is some type of therapeutic activity that can be done that could alleviate some of the stress.
Okay. So again, we talk about being mindful, mindfulness. There are different YouTube. Woohoo! YouTube. We did not understand how YouTube was so great. YouTube has like meditation music. There's music to, if you're stressed. There's music if you're having anxiety. There's music if you need to sleep. There are sounds that you can just listen to. If you're into yoga, practicing yoga, practicing to be centered, practicing the here and now, right? So being here and now, and the mindfulness is that you are aware of your environment. Let's just say before you go to bed and you sit on the bed and you're aware of 5 blue things, 3 red things, 4 pink things, just making sure that you are centered into your environment. Being grateful, right? Just being grateful, finding, positive affirmations. That's a great way to start centering yourself, because you are, you're thinking the environment. And if you're spiritual, you're thinking your God, your Buddha, your whatever it may be. Just being thankful, it's causing a positive effect in the brain. And when the brain starts feeling good, the body starts feeling good, and everything starts, just working itself through. Exercise. And I don't mean to go and run 5 miles. I don't mean to be, doing all those things, because we don't want to hurt you or the baby, right? Going to walk on the treadmill, going to take a Zumba class, doing something that brings joy to you will bring joy to the baby. So those are some of the things that you can do, and the practices, things that you enjoyed doing prior to getting pregnant. Maybe just going out with your girlfriends and just having an adult conversation, still trying to be in the know versus being by yourself and feeling sorry for yourself when this great thing is happening within you.
That is awesome. Thank you so much.
You're quite welcome.
Now I'm going to introduce our second guest, and this is Chanel Jones. She is a birth doula. I'm going to decrease and allow her to increase. Hi, Chanel.
Hey, how are you? Good evening, everyone. So my name is Chanel, and I am a birth doula and childbirth educator. Just to talk a little bit about what is a doula, right? You hear the word, you may never have heard the word. You're like, what? Basically, a doula is a labor support coach, is what we like to say, among other things like advocate, educator, emotional support, physical support. We provide a little bit of it all, right? And so it's literally our job to help you understand the, from inception all the way to birth. So basically to help you through the whole process, through, your body changes over time, what's happening with the baby. As far as childbirth education goes, just to help you have an understanding of like what your body is going through, what to expect during the laboring process and thereafter, to prepare yourself for after the baby comes. And so, I make it a point to provide the best care and to really make that emotional connection with my clients so that they have an understanding that they're not alone. They don't have to be afraid. Birth is a beautiful thing, and it's not something to fear. It's actually a wonderful blessing. And so part of being a doula is to just make sure that everyone feels supported. It's not just for the mom, it's for the partner, it's for the family. It's to make everyone feel like, hey, I'm a part of this process too, and I can contribute to giving this person a wonderful birthing experience, your loved ones being there for them.
Well, I have a question. What inspired you to become a doula? What was it about being a doula that brought out that inner feeling of that you wanted to help other women?
Like a mama bear thing. Yeah, that's the best way to explain it. I had like my own experience. That's usually how, it's usually how it happens. Unfortunately, at least a lot of women that I know who have become doulas themselves. I had a very traumatizing birthing experience. Things didn't go the way I had planned. It was an unplanned pregnancy from the start. So, in my undergraduate years, and otherwise healthy pregnancy, carried over an extra 2 weeks. She didn't want to come out, and ultimately ending in a C-section, an emergency C-section, and so on and so forth. So, twice I almost lost my life, basically. First, the infection, from the meconium, and thereafter I developed white coat syndrome and high blood pressure and all that stuff, and being separated from my baby. So it was a lot, and having to dump my breast milk was a lot to deal with, because the antibiotics I was on, I couldn't breastfeed for like 2 weeks. So in all my experiences, it just led me to realize how there was such a need to advocate for yourself, to have someone teach you like what your rights are in the hospital, to understand the process of like what's going to happen to you while you're there, and to just have that support going in and coming out. And I kind of just over the years have been like being a doula-ish to like my friends and family. And ultimately I decided to become an official doula because the program started where I worked, and it just seemed like a great opportunity and for half the price. So that started me on my official journey to become a doula, and I've loved it ever since. I love being able to empower women to not be afraid of their bodies, not to be afraid of the process, and to go in prepared for what's about to take place, and to prepare them and their families for what to expect.
Okay, I have another question. In what ways do you prepare mom, partner, and family for the baby's arrival?
So there are a number of ways you prepare mom and family for the baby. So as a doula, I personally provide a couple of prenatal visits, we call them. So you do like your initial interview, and then you schedule prenatal visits, which happen throughout the pregnancy. And so depending on when someone gets a doula, I'll determine how many of those you get in before the baby comes. I usually like to have at least 2. And this way you can go over like a birthing plan is very important to at least have one. They say like make a plan and God laughs, right? But it's good just to have one. It can always change just depending on how you feel, and that's okay. But at least it gives you a better understanding of what to expect. I also encourage the family and friends who are going to be present during the laboring process to come when we go through like the laboring motions. And so what I usually do is walk them through the house and be like, oh, this is a comfortable area. Let's try a couple positions here and see how that feels. Oh, Dad, come over here. I'm going to show you some counter pressures. Mom, oh, you want to learn how to like massage her back and like help her relax and breathe. It's a very like family oriented experience for me because first off, it helps everyone to feel like they're contributing and doing their part, and it's very empowering, and it takes the scare out of it, right? Because everyone's afraid of pain, but pain is something that's very natural for us all to experience. And so when you remind them that you have this like ability in you to deal with pain naturally, it helps, like if you see your partner in pain, it's okay. It's a pain with purpose, just to give them understanding. I think it gives them that reassurance that they need going in where they don't have like a total freak out moment. And ultimately just education about your body, the baby, your body, pre-baby, your body after baby, mom and dad, mental health screening, all that stuff is very important. And it's a part of the process so that people ultimately I feel like knowledge is power, and like when you educate people accordingly, it takes the fear away because you fear what you don't know, right? So it's just important as doulas to educate and teach them how to advocate for themselves as well, to speak up for the things that they would like to have for the birthing experience.
Okay, I have another question, but this one's for Darlise. So the question that I have is, would you recommend someone who's in their third trimester to come and speak to you because they feel that they're going through these emotional roller coasters and, they don't know if they should because, everybody believes that once you're pregnant, you're supposed to be super happy. You're supposed to be on this high of euphoria, which is not true. We all go through different stages. Some of us are questioning, why are we doing this? Is my body ever going to bounce back? And it sounds selfish, but we do think this. Am I going to lose my gut? Am I ever going to be a size 2 again? Some of us do. It's genetics, and others, it does not. So would you recommend for women to come out and speak to someone about the different things that they're feeling? Because I think carrying on those feelings further into the birth actually transfers to the child, like you said before.
At any point from day one, I would strongly suggest that, you come in, for sessions just to process. You're coming in to see someone, to have a conversation, right? People think that when you're coming to a therapist, it's because I'm crazy or there's something wrong with me. There's nothing. There doesn't have to be something that's wrong. It could just be that you need that support person. I see Erica here, and Erica's like, no, I have my best friend helping me, right? And that is your person. That could be your therapist, right? If you don't want to go to someone. But I do strongly suggest you do go to someone, because when you're talking to a therapist or a counselor, you're allowing that person into your life. You're allowing that person to help guide you and to be the best person that you can possibly be. And sometimes we have these crazy thoughts, right, that goes through, and it's like, oh my God, okay, wait, who do I bounce this off of? Is it really crazy thought, or is it just me that's saying this? I remember, okay, I'm going to age myself here, right? So Ricky Lakes, and I was home and I was watching Ricky Lakes, and I used to make like these comments and like, oh my God, what did this parent do? And, it's until you are a part of it, until you kind of get to see the other side that, oh my God, you're not that crazy. Like, people do think like this. People do have these feelings and these emotions that goes through them, and you feel like such a bad person for having them. And that's where, maybe calling Chanel back. Hey, listen, this is what's happening for me. Oh my goodness, what is this? Hey, Darlise, can you help me go through this? Because I don't think this is right, whatever I'm thinking. Or maybe it is right what I'm thinking. What do you think about that? So you use the professionals out there to kind of help you and guide you to decrease the stress, decrease the unknown, decrease the anxiety of what is it that's coming up. We talk about mommy brain. That is real. We know this is real, mommy brain, where you forget everything. You don't know anything, and the little baby is absorbing everything. So your reading is not going through you, but definitely when this baby comes out, it's the smartest little thing ever. Where did you get this from? You must be from me, not from dad, right? So it's those kind of things. Even what should I read? How should I prepare myself? Do I have a voice when I go to the doctor? What about if I get to the doctor and the doctor is having me sitting there? Can I say something, or I just have to sit there for 3 hours? So all of those things are there that you can go through and have someone that you can talk about your last experience that you went to the doctor. This is what happened. Chanel, oh my God, can I just tell you, I'm done. I'm so done with this. I just want you to be there for me, and I'm not going back to this doctor's office. I'm not doing this. And it's for us to kind of bring it down. Let's breathe. Let's process it. This is what we can do for you, and this is what you can do for yourself.
And I always remind my clients that I'm not a medical professional. I'm not certified in any way. And I always strongly encourage them, especially if they have, I do a mental health screening if they've ever had like depression or anxiety. I automatically, and honestly, I do it with all my moms, you should find like a prenatal support group, because they do have them now, and it makes a difference, because it's better to catch it early, because you can get depression prenatal, like prenatal depression. You can start showing symptoms sooner. So it's better, those types of things, it's been proven that if you have a support like circle, it's easier to overcome and to get better when you have the proper support system. So I always encourage my moms to find like a good mothering circle group, where you can be supported, because you do have these thoughts, you do have intrusive thoughts and stuff like that. And it's good to have like a safe space that you don't have to feel judged, that you can go to kind of just vent to. So I do encourage all my moms to take the proper professional channels to deal with their emotions and their feelings. It's very important to always seek professional help when dealing with mental health. Yes, it's good to have girls that you can vent to. I offer emotional support, but at the end of the day, when did you schedule your appointment with your therapist? Did you sign up for the mothering support group, for, prenatal support group with your doctor's office? They don't have one? Great. I'm going to find one for you. And I want you to go at least once a week. It's very important to feel supported throughout your pregnancy, because we do tend to suffer in silence. I'm an advocate for the Postpartum Resource Center of New York, and a lot of women just are afraid. Mental health is not something that's readily accepted in society. In most cultures, it's something that's frowned upon, but it's important to encourage people to seek the proper channels of help always.
Okay. Question.
And again, again, it's, if you're looking at overall, it's 20% of women that are during their pregnancy suffers from low to high levels of depression. So if we're talking about 20%, and we're not, they didn't even break it down to culture. They didn't break it down to women of color. They didn't break it down to Asians. They didn't break it down to Hispanics. They said overall 20%. So when you break it down culturally or ethnicity wise, what are the numbers? What are we looking at? So yes, I'm glad that, we're talking more about the mental health aspect. We're looking at the mental health. We are, assessing for the mental health. How many times you've gone to an emergency room and they don't assess for certain things. They just think, oh, okay, whatever it is, that's what it is. I remember I went to the emergency room, and because I had like a toothache or something, and my face was swollen, and I'm waiting, and I'm like, okay, somebody's going to ask. No one asked about domestic violence. I was like, oh my goodness, I could have been beat up. I could have been kicked in the belly because I came for one thing. That's all they looked at. But what about safety? The safety of the woman, safety of the baby, and, what kind of relationship this person is in. So again, mental health is serious, and we have to take care of it throughout the pregnancy.
Okay, I have a question either one of you could answer. Now, we've mentioned culture. We've mentioned that we need to speak out. Now, what if you're part of a culture where mental health counseling or therapy is not discussed, and you are in an environment where you need help and you're afraid to speak, or you can't, or you don't have the voice? What would you guys recommend for that mom?
You want to go?
Well, the first thing I recommend, if it's just something that's shunned upon, is, do you have a friend? Do you have a friend that you can confide in, and at least start there, right? And then you slowly but surely just keep having the conversation. It's kind of like you just have to like drop it in, right? Because you're trying to fight this like embedded cultural stigma. And it's just like, all you can do is just share. So I'll let you know. For my one client, she had this issue. And so I was like, you know what you could do? You can go on one of the websites that has a testimony that's very similar to yours, right? And just send it in a link to your family member and be like, read this woman's testimony, right? And like, let's discuss it after. And be like, that woman, she got help for that. And she's very similar to what I've been through. And I think that if I saw a therapist, I could get the same help too. Just as like a and opening the door for the conversation even. So that was something that I told her that I think was like kind of helpful, because sometimes people just need to understand that it's more common than they realize, and that it's not scary and it doesn't have to be something crazy, but we do need help, and it's okay to ask for help.
Yeah. So one of the things that I do, and I'm lucky in the sense of is private practice versus working in a hospital, working in a community mental health center, where, a lot of the clients that goes there, that they're kind of mandated, and, they on the very serious side of everything. With private practice, people are seeking you out, and majority of those people, even males, they seek out the services because they need someone to talk to. And I have people now that it's like, they'll ask, the family member is like, you don't seem well. When was the last time you went to therapy? So again, it's being brought up more often. It's looked at more positively versus back in the day. And when we're talking about culture, a lot of our families are more acculturated. And again, the great thing with reality shows, everyone's in therapy. What? I'm going to therapy because Nene Leakes is in therapy. All the cast over here is in therapy. So they're looking at more of, I could be another Kim Kardashian going to therapy versus, no, I'm going to hide it. I'm going to just keep it inside. I think what we need to understand is that when it goes beyond that level of just depression, right? When we're talking about, we're hearing voices, we're talking to ourselves, we've really crossed over. That's the scary part. And that's the part that most people hide when they're really having those delusions. They think everyone is out to get them, that the doctor's trying to kill their baby, they're trying to take their baby away. Or we even have pseudo pregnancies, right? Where the woman swears by any means necessary that she's pregnant. Her stomach starts growing. She's having, the sign and symptoms of pregnancy. She's having the vomiting, the everything that associates with pregnancy. And in reality, it's just a delusion. And that's another level that we have to address too, because now I'm waiting for this baby and it's after 10 months. Now it's 11 months. Now it's, oh, wow, am I really going to have this baby? When is this baby coming? They're starting to feel phantom pains, lower back pains. They're having cramps. They're having Braxton Hicks, everything. That's when we really need to have open arms there for them, when we need to have the mental health community there, the support to help them through that process, that it's okay. This is reality. You kind of lost the baby. And this is what we're going to keep going. We're going to help you through this process.
Okay. And what would your advice be to our dads? Because we all know our dads go through it. They don't talk about it because they think it's not a man's thing. They're not supposed to talk about it, supposed to keep it in. But I firmly believe that men go through it as well. The same way a man could gain weight when his wife or his significant other or partner gains weight during the pregnancy, that means they're also going through it emotionally. So what would be your recommendations for our dads out there?
Same thing.
I was going to say the same thing. They do. And I assure them also, I go over with dads, like, you too experience postpartum depression. It's a thing. And I also have I call it like a scale, like a test that I give my clients. I'll take like a baseline before and then after, just to see if they've shifted, and then if they score like a certain number, and then I have to, I refer them to seek professional help. But I do inform dads that definitely they too can experience depression, and that it's okay to ask for help, and they don't have to be ashamed, that it's very common.
And even, the dads that are afraid to hold the babies, or the dad that are afraid to, to be intimate with their wives or their partners, all of that, causes issues too, because your body is still screaming for it. You're still having these wants and needs and need the intimacy. The dad wants to have intimacy, and some of them are afraid that they might poke the kid eye out. Okay. So again, it's like, let's talk about this. Let's, come into a place where we feel safe, that we can trust. Okay, what is the information? And if you don't know it, where can I get this information? And some fathers, they're not even talking about it with friends. They're just keeping it inside, and they're coming out irritable, they're angry, they're not supportive because they don't know, or they're shut down because they don't know. And instead of using our communication skills and our listening skills, it's like, okay, well, I heard this person did this, so I'm going to do that too. Well, it doesn't work for your situation. So how about coming together and having the exchange of, what do I need from you and what do you need from me? And, in order for us to have a healthier baby, or for us to be healthy parents, it starts then. From the time of, being this baby being conceived till the end. Let's start earlier than later.
Exactly. And it's important also that I also remind my expecting parents, partners, that it's important to set up a support system for after the baby has come. Like, everyone wants to come and visit, right? But like, a productive visit. Like, yeah, you can come over, you can sign up to do laundry, these days. You can sign up to cook dinner on these days. And then when you're visiting, like, if I have to take a shower, you can hold the baby then, and it's important, that you allow them to, even in the hospital, sometimes, maybe you don't need everyone coming up to the hospital. I mean, you can't now, which is, COVID, but it's important to have that bonding time even is essential between, like, not only are you guys like having this new baby, but you just became new parents as like couples. You know what I mean? Like, it's a big deal. And sometimes people forget to like take the moment in and not try to like please everyone else. And so it's important to remind them of that too, like, set yourself up so that like when your baby comes, that you don't have to stress, like, what about feeding schedules? What about, sleeping schedules? These are things that people fail to like have a serious conversation about, which is where all the stress and everything can build up. And so that's why it's important, for them to have these conversations, or even to just remind them or to suggest, because this is a lot of the reasons why people end up like losing it, like after the baby comes. So I also like try to remind them the importance of like setting up the proper support pre and post baby. It's not just, pre-baby, it's post too. And make your visits useful. Most of the time people are entertaining guests, and they're the ones running around crazy trying to like cook and clean. And no, you're coming to help me with my baby. Like, you're going to clean and I'm going to sit there and I'm going to nurse my baby while you like wipe down the counter and are helpful to me, because you want people to be a help and not a hindrance to your healing process, to your journey into motherhood. It's important.
Takes a village, right?
Yep.
It takes a village. In other countries, like, moms don't do anything for the first month. Like, you got people coming and staying this week and that week, and like, you don't lift a finger. You just feed the baby and call it a day. Like. So I try to remind people of that it was never something you're meant to do alone, and it was always supposed to be a community behind you when your baby comes. You have a village.
And I always
use your village.
Yes. I always say we spend 9 months focusing on mom, and even the medical field focuses on mom for the first 9 months, and you're watching her grow this baby, and the moment she drops, everyone forgets about her, even to the point where we're celebrating the shower. No one gives mom a gift, not even a slipper or a robe. Not, I'm like, you spend that much on me, for 9 months, and then now once the baby's gone, I get how depression could kick in. You're like, wow, you feel forgotten, you feel left out, no one remembers you. So I get it. I get it. But ladies, this was amazing. So the last question that I have for the both of you is, what would you want our viewers to leave with? What wisdom do you want to impart?
For doulas, you want to have a doula. I mean, some people get it right when they find out, and they want that support all throughout the process, the birthing, like the gestation process, or, some people wait till the last minute, like the last month. But at the end of the day, even if you don't end up hiring a doula, talk to a doula, like find out. Some of us, like me, give out information for free just because it's important for you to know, or at least send you the right links that you can look it up for yourself, because it's empowering, and I want everyone to have a great experience. But if you are looking for a doula, please interview at least 3. You don't have to settle on the first doula you come across. It's important to interview them. You can find out a lot in that interview, no matter how long it lasts, 15 minutes to an hour, like it's up to you. But just remember that you're not alone, and you should feel supported, whether it's your doula, your OBG, your midwife, like you should feel supported. This birthing experience is your own, and you're not just another number. And anyone who treats you like a number, you might want to reconsider your options as well. It's important because this is your journey and it's unique to you. Your birthing experience will not be like anybody else's. It will be your own. So enjoy it, claim it, prepare yourself for it, and enjoy,
Just to piggyback on what Chanel said, it's that, the interviewing process, right? And we push for advocacy. We push for you to make that decision. Your decisions can be made up front, even to like, who's your OBGYN? You don't have to take that person. Just because your friend had a great experience with that OBGYN doesn't mean you're going to have a great experience with that OBGYN. That person could be a jerk by the time you get to them, right? And, I remember the nurse was like, do you want a picture of the doctor? And I was like, so again, you have to advocate for yourself. You have to know what feels comfortable. And, we have free will. And there is the red flags. Our body sends us signals, the red flag. I don't like that person. Oh, I like this person. Oh, we really vibe really nice together, right? Do your research. Interview your OBGYN. Interview your therapist, right? Pregnancy, no pregnancy. Issues, no issues, you want someone to talk to. You have the right to choose who you want to be a part of your life. Where they say we don't have the right with the families, but we can still close our circle. We don't have to have everyone in there. But again, self-preservation, the more you are relax, the more you allow this child to be and not be in control. Sometimes we lose it too. And, that's one thing I really want you to take heed is the control, right? We're trying to make sure like we don't eat too much because we don't get too fat. We don't do this too much. Just let go.
Enjoy the
Let
moment.
it go. Enjoy the journey. Every pregnancy is different. Enjoy the journey. Eat in moderation. Make sure you're hydrated. Make sure you're taking care of yourself. And just remember, if I don't stress it enough, the body keeps the score. That baby's going to keep the score. So the more you're relaxed, the more you're having a healthy pregnancy, the happier your baby will be.
Well, I thought that was going to be my last question, but someone sneaked in a question in the chat. Said, Erica says, mom shaming could be detrimental. What do you guys have to say on that?
You said mom shaming?
Mom shaming.
Yes. So I have this rule that nobody can tell me my truth but myself. And you have to walk in your own truth. No, you can't. No parenting is the same. You can't approach each child the same. And your kid best. And I don't really pay any attention to the naysayers and the haters, and that's kind of how you have to walk through life. Like, just confident and reassured that like you love your kid and you're doing the best you can. And I'm an advocate for that. If you don't know it, research it, read a book, pick it up, ask questions, like if for yourself that you've come to the conclusion that after your own research and, trial and error, that this is what works for you and your family and your kid, bye-bye haters, mom shaming, good day. I don't pay any mind to that, because at the end of the day, you have to walk in your own truth, and you're not here to people please or make other people feel good about your life choices. You live with your life choices. And if you feel confident and you can look at yourself in the mirror and feel good about what you're doing, and you rest your head at night knowing you gave it your all, or even if you had a bad day, who cares? We're not perfect, and that's okay. And that's the part that you just have to be okay with, That's it. Don't worry about other people. Just worry about yourself. That little cute girl, when she was like, worry about yourself. Just worry about yourself. If you're good with you, that's it. That's all you can do.
And a lot of times, they're like, oh, there's no books. No. And even there are books, it may not relate to you the way you want it to relate to you. It's, what is it that you're doing, right? Safety first. Taking care of yourself, right? Because at the end of the day, you have to look at that person in the mirror. You're not looking at anyone else. And as I said, your circle may start off like this and end up like this. Oh, look, like this, right? You want the support to be there. And if you can't be supportive, why do I need you in my corner? Because then that's a negative energy that you're introducing to me right now that I don't need. I need that village, but the village I need is a positive village. The village I need is the village that's going to say, you know what? Relax. I got this. Oh my God, you're like the best mom ever, right? That's the village that I need. I don't need a village that's going to tell me how everything I do is just not perfect. We don't need that.
Yeah.
So you, again, have to advocate for your mental health. You have to advocate for yourself to know who you are and what you're doing to be the best mom that you can be.
Oh, wow.
Also, just for the young ones, I hate to say it, but, if you are a mom and a lot of your friends are not, it makes a huge difference. And it goes without words, When I was young and I was a young mom, and it was hard to keep friends who were not parents because they just don't get it. And even I have older siblings who had kids after me, and she's like, I get it now. I get it. And I apologize because parenting is hard enough without trying to take the criticism from other people to heart. So just like she said, make sure you surround yourself with the right people who align with your vision, and just keep it moving. Hold your head up high. We all do the best we can,
You did something amazing. You brought a life into this world. That alone deserves kudos. I don't give a flying Fitbit about anybody else.
That's what I was thinking too.
But lady, oh my gosh, thank you. Thank you so much. Thank you so much. I think we reached a lot of women who are not talking or who have yet to find their voices. And I think this right here might spark something. We planted a seed, and that's where it all begins. Oh, thank you. Thank you again. Have a wonderful evening, everyone.
Bye.
Bye.
Take care.